project on adolescents with major depressive episodes. A major depressive episode and symptoms can be defined as a period of 2 weeks or longer, during which there is either a depressed mood or loss of interest or pleasure, and at least 4 other symptoms that reflect a change in functioning. Suicide among adolescents is a serious problem, noting that sadly suicide is the second leading cause of death among adolescents. Most adolescents who consider or attempt suicide have a significant mental health disorder, that usually being depression. Most often, suicide attempts are impulsive and based off an array of feelings. Certain protective and vulnerability factors can increase or decrease the risk factors for adolescents to experience major depressive episodes. Individual factors, family, school, peers, community can also influence mental health. The National Institute of Mental Health notes that an estimated 3.1 million adolescents have had at least one major depressive episode. This is approximately 12.8% of adolescent population. Of this number, approximately 2.2 million adolescents have had at least one major depressive episode with severe impairment. The prevalence of major depressive episode was higher among adolescent females, 75% compared to that of males at 25%. Healthy People 2020 leading health indicators of specifically mental health report that both adolescents with major depressive episodes and suicide are both getting worse. Adolescents with major depressive episodes, with the baseline reported in 2010 of 8.3%, is at an incline with a recent report of 9.1%. Suicide had a baseline report in 2010 of 11.3% and the current report of 12.1%. As you can see from this data, both are getting worse in the specific at-risk population. Depression and suicidal feelings are treatable mental health disorders. The adolescent needs to have the illness recognized and to be diagnosed by a healthcare professional. Statistically, as you can see here, 60% of adolescents with major depressive episodes do not receive treatment at all. Unfortunately, there is no evidence that interventions in primary prevention of mild depression are effective, but once mild depression is diagnosed, a provider may be able to prevent the adolescent from experiencing major depressive episode. PCPs are in a great position to recognize and treat depression in adolescent patients and have demonstrated effectiveness in doing so. These preventative treatments may include active support systems and monitoring. These would include educating the patient on coping mechanisms, encouraging the patient to participate in extracurricular activities by increasing their view of self-worth. Providing the patient and their families with community resources and reading material is helpful. There is also evidence that continuous monitoring and active support in early mild depression is especially essential in cases where the adolescent refuses treatment. Evidence shows that 20% of depressive youth respond positively to these supportive therapies. If treatment is needed for moderate or severe adolescent depression, primary care physicians may choose to treat or refer their patients to mental health services. Such indicators may be if the patient has detailed thoughts or plans of hurting themselves or others. But if this is determined not to be a concern, the provider may provide or proceed with other intervention like psychotherapy. This aims to correct maladaptive negative beliefs and thinking patterns that are associated with increasing depression. Antidepressants are also an avenue for intervention, along with monitoring, dosing, and evaluation. The FDA has only approved a handful of serotonin uptake inhibitors, or SSRIs, for youth with depression. These have been shown in affecting and stabilizing these patients and decreasing suicidal in youth. It is important for providers to make a clear treatment plan with their patients and their families. Physicians would need to wean patients off of antidepressants when necessary to avoid withdrawal symptoms. Educate the adolescents and families on any warning signs or symptoms that may trigger the need for reevaluation. Continue psychotherapy treatments if deemed necessary, and encourage follow-up appointments to reevaluate. Evaluation of symptoms and care of adolescents with major depressive episodes includes, most importantly, the patient evaluation. This allows the patient to feel like they have an active part in their health care and that they are heard. Though this requires the patient to seek medical attention and to actually express a clear picture of how they are feeling and what they are thinking. Evaluating medication has evidence-based information that SSRIs can improve the symptoms of depression, but medication compliance is noted to be particularly poor in this population and significantly impacts treatment outcomes. Family involvement can also greatly influence the adolescent treatment plan and success both positively and negatively.